Good evening. My name is Suki. I'm your Vice Chair at the NPA, and welcome to all of our Greater London members of the NPA. I've got a really exciting proposal for you all to get some information about a point of care diagnostic for your community pharmacy. I'm really excited about it, and I'm hoping that those of you that have joined us are of the innovative kind, a little bit like myself and many of my other colleagues here on the panel. This is a really good partnership for the NPA and Imperial Diagnostics, which is a company where we're going to have our guest speakers today, which I will introduce you to, and you'll get to find out what this is all about. How can you provide really good point of care for your patients in a way that they can't get swift, quick responses from their GPs? This is something that's going to bridge the gap between what is happening in the NHS and what you can provide as a private service. So I really hope that you get value out of this conversation today. And equally, I recommend, or I push for you to think of questions. Ask questions today. Anything. No question is a silly question. Honestly, I am the queen of silly questions. So if you are embarrassed to ask, put it in the group chat. I'll ask it for you. And that's all I'm going to say. So with great pleasure, I will introduce you to the panel today. We have, I think I'll let you guys introduce yourselves, because I think it's nice for you to give your version of who you'd like to be known as. So I'll leave it over to you, gentlemen.
Well, I'll start. I'm Gary. I'm representing NPA Connects this evening, and I've been working with Michael and Richard on bringing this to pharmacies. In particular, my side of the bargain is to find ways that pharmacies can drive traffic for these services. And to do that, they need to build community awareness and make sure people realize there's another option for them for this type of service. And so I'm going to be very much in the background, because I'm going to hand you over to the irrepressible Michael Lennox and also Richard Payne, who will themselves introduce themselves as we go along. Over to you, Michael. Or Richard.
You go first here, Richard.
Yeah, I'll take the lead in the first instance. I'm Richard Payne-Smith, CEO of Imperial Diagnostics. We are a company that is 4 years old. We focused on point of care diagnostics and bringing diagnostics to the high street, really to try and negate the long waiting times that people were having with the NHS. Our focus is to work very closely with the NPA, who have, I believe, 6,500 members, and to see if we can launch point of care diagnostics to the high street through the NPA members. So I'm going to lead you through the slides after Michael Lennox has explained what the Pathfinder campaign is all about. So I'm going to keep quiet now and hand over to Michael Lennox.
Before you jump in there, Michael, there's just one point of question. Completely forgot about this piece, but we're going to be answering questions at the end of the presentation. But feel free to jot them down into the chat area with your questions. I'll be delighted to answer those when we round up. So sorry, Michael, over to you.
Absolutely, thank you. Well, look, members, pharmacy friends, good evening. As you can read on the blurb there, I've been around since God was wearing short trousers and have done a substantial number of different roles in community pharmacy. But what I'm absolutely devoted to at the minute is independent pharmacy and bringing opportunities and supporting the NPA to actually realize a kind of a future pharmacy model. I have worked for most of the corporates in their service design departments, etc. But at current with the NPA, my role is about integration, and it's about positioning the great 6,000 members we have across the 4 countries of the United Kingdom to be able to take on new clinical roles and commissioned contract roles. However, the offer that we're talking to you good people tonight about is a consumer-based offer. So look, it's my proud privilege to support the NPA and to support you as members. So Gary, let's show the good folks some slides about what the offer is. So look, about a year ago, the NPA started looking at this market really seriously, because we were understanding from conversations that there was an opportunity. We then shopped around, looked around, and it was quite a scary looking market with about 1 million different bits of kit and 1 million different things one could do. So we then got lucky. We got connected to Imperial Diagnostics, and Imperial Diagnostics we're just that leading edge company that we're trying to bring packages of solution and actually not just flog a machine, but actually bring a consumer offer that pharmacies should be participating in. So we were really pleased and proud to sign up Imperial Diagnostics as a trusted partner to the NPA, and to work with them and indeed Gary at Precision Marketing Group to create this package of delivery. We'll see later on with our resident boffin Richard talking us through the machines and the tests, etc. But in essence, the plan here is through our partnership to really introduce a campaign, and we've deliberately come to Greater London to launch that point of care diagnostics campaign, because we know how chock-a-block full of innovation London is and beyond, and we also know that the market in many bits of London is just ripe for a consumer pays point of care testing diagnostic service. So look, the campaign launches now, and we're looking for a quick 50, a swifty 50 to come on board, so that we can then land the package, do a little tiny bit of further testing of the package with a view to then rolling it out in controlled phases beyond London, and yes, expanding in London, and ending up with circa 500 or 1,000 pharmacies across the 4 countries of the United Kingdom making a good turn at this. So look, it's more than just a new service. You good folks, many of you will have been doing a version of point of care testing for the last lot of years anyway. You're doing the BP case finding in our national contract in England. You may have been commissioned to do NHS health checks. You may already have a consumer-based service where you've got a bit of kit that you've been playing with, or indeed taking bloods and sending them off to labs. But this package that we've put together, we believe, is an opportunity to elevate the health impact that you deliver in your community and unlock that sustainable new revenue stream. And as you do that in your consumer service, we begin to make the case more strongly for us doing it in a commissioned service as well. Move her on, Gary, thanks.
Just a quick question, because this is relevant. I've just had a quick question come up with a pharmacy that's based in Hertfordshire, and they're wondering if they should hop off the webinar or stay on.
No, stay on, Hertfordshire friends. We will be getting to you as the summer turns to autumn. So you need to think about this now. But look, we're not averse to embellishing our 50 Pathfinder with other super keen people. And in fact, we've had people twisting our arms and bending our ears already in Bristol, in Belfast, and up in Scotland as well. So no, stay, learn, and we will accommodate you ASAP. So look, if you think about what the participating pharmacies will have an opportunity to do, firstly, to establish yourself as a patient care hub. You already are, but having diagnostics at your fingertips will just bring that new dynamic, as well as a new and sustainable revenue stream. You know, we've been kicking this around, and we don't think it would be unreasonable to be doing 20 tests a week and taking 50 grand a year and banking 25 grand net margin on this. There is a byproduct of this, which is also supporting the NHS, and you'll have seen the 10-year plan. But if we can reduce a little bit of pressure on key blood tests in the NHS and case find and triage people into the NHS with disease states earlier, then it will save the NHS heartache and money in the long term. So this improving early detection and intervention across a whole range of health conditions. And the other thing, Richard will talk to this later on, we think there's an initial phase where we focus on some high volume or higher volume tests, but actually, I wouldn't say the sky's the limit, but you could go from 6 to 60 tests pretty easily. Richard will explain more. And again, you're building that empowerment of your patients, but also that relationship with your patients, that they know that you are there to help their health, to manage their health and well-being. And colleagues and friends out there, we're all a little bit worried about something in terms of how our bodies are functioning, probably. And this is a great opportunity for you to assuage people's worries and triage them in the right direction. Last slide for me, I think, Gary. So look, this trusted partnership is really important. And the other thing to note is Imperial Diagnostics then behind them have a really useful brace of trusted partnerships as well. So what we're doing is we're bracing or bringing a matrix of delivery. And with the platform and the product that Richard's bringing to Imperial Diagnostics for diagnostics could see you delivering up to 60 different blood tests within a consultation. So we're really excited about this. I'm personally really excited about this. I find myself with a foot in the NPA camp developing this, and in a foot in Richard's camp guiding him so that he brings the right offer to the NPA. So I'm going to hand over to Richard now, who will walk us through the detail of this. Richard, over to you.
Thank you so much. Okay, so we have treatable conditions. These are generally capillary tests, finger prick tests, cardiac markers. We do have a good range of cardiac markers comprising CKMB, CTNL, troponins, D-dimer. There's a combination test, which is troponin and D-dimer, myocardial, and that off the top of my head is all I can remember. But we've got diabetes management. Obviously, that's HbA1c. We've got inflammation, infection. So that is CRP and HS. CRP for heart health. We've got thyroid and hormone. So those tests we would probably join together with fertility and women's health. So they comprise LH, FSH, TSH, AMH, progesterone, just to name a few. Liver and renal function, we've got CYSC and albumin, which is a urine-based test, if pharmacies wish to go that route. And the early stage cancer markers, we have CEA, AFP, and of course, prostate, which we perceive as being a big test for pharmacies. If they're advertised properly, you know, every guy over 40 really should have prostate tests just to alleviate any alarm. So we see that as a big one. It's certainly going to be in our first stage campaign list. So if we can, CEA and AFP are general cancer markers. They won't necessarily tell you where the cancer could be. They'll indicate that there is an elevation of cancer markers in your blood, and then it would be very wise to be referred to your GP for further testing. I think it's important to realize one thing. We're a triage screening service. So we cannot be looked on as pathology. We are not an alternative to pathology, because what we are there to do is to assess that there's a problem. And we will indicate that problem, and then it gets referred. So that's a very important thing to realize. And it's either referral to a GP, or in a case that I had 3 months ago, when I had my CRP test and it came out at 144, when it should only be 10, I was referred immediately to A&E. Thank God nothing happened, but it was nipped in the bud and I went on antibiotics pretty swiftly. So on to growing your business and increasing your revenues. Diagnostic enabled pharmacies, well, it stands to reason if you're introducing a new service and the service is advertised properly and the tests appeal to people. That's very important. People who are walking past your pharmacy, see a poster or a high-vis screen in the windows. People in central London, we know how difficult it is to get doctor's appointments and even more so blood testing appointments. I know that certain parts in central London can take up to 6 weeks if a person doesn't have a preordained condition and the surgery knows that they need these blood tests on a life-saving basis. It can take easily 6 weeks for a young person or a middle-aged person with no conditions or no history to get a blood test. This is an opportunity for people to manage their own health, take their health into their own hands and say, look, I want an HbA1c test, which all diabetics have to have every quarter. In this country, we have 40 million HbA1c tests. That represents 10 million phlebotomy hours in surgeries. Now, we all know that the two governments that have been in the last 5 years have both promised to reduce waiting times in GP surgeries. That hasn't happened. And I think it's now time to give people an alternative. If they want to get an HbA1c test done, then fine, they can walk into a pharmacy, book an appointment and have it done with results in 15 minutes. And our machines are very good at giving HbA1c results. So in my little speech then, I think I've covered 1, 2, and 3. Daily health campaigns. The campaigns we are going to do initially, and we have advertisements which you'll see in the end of this presentation, are ferritin, vitamin D, CRP, PSA, D-dimer, which is for blood clotting, and thyroid stimulating hormone, which is a very common test for people who are lethargic, tired all the time. There are many conditions that can be alienated by being tired and lackluster. Cortisol is another one. But TSH is certainly a test that you can strike off by having a blood test in a pharmacy, and it's a finger prick test as well. Encourage patients to visit the pharmacy first. Yeah, it's an important mission of ours to get people to think of the pharmacy first. And, your first instance right now, you're thinking, oh, I don't feel so well, I better call the doctor. Well, actually, what we're trying to achieve is a situation where the public will think, I'm going to go to the pharmacist and have a finger prick test. Maybe the pharmacist can tell me what's wrong and I don't have to make an appointment with the doctor. I can just walk in, book a test and have it done, results in 15 minutes. So I think that's a key thing we've got to put out first. And it's certainly been one of our missions at Imperial Diagnostics. Why choose our devices? Well, why not? Right. Do you want to give the next slide, Gary? 3 machines we have. We have the ATR 900, which is a handheld, well, maybe just a little bit bigger than a handheld. It's got a 10-hour battery life. It has a good range of capillary tests, including all of the ones that I've just mentioned. It's got, I think, 18 tests in total you can do with finger pricks, and that does include cardiac, inflammation, infection, fertility, diabetes, early stage cancer markers, liver and renal function, thyroid and hormone function. This is the machine. So when I say it's handheld, it really is handheld. Very versatile. If pharmacies have a service where they do outside patient help, and they help people who are in their homes and can't make it to the pharmacies or GP surgeries, that is a perfect size machine to put in the car. We can supply cases with that, aluminium cases for people who actually want to take them outside the pharmacy. The IDL 101, even smaller. This is a machine that does all the tests again that we've talked about. It also has 87 tests in total, where we have quite a serious lean towards whole blood, serum and plasma. So if anybody wants to go the extra mile and take on a machine that does phlebotomy with very good results, that is a machine that we would certainly recommend. The AFIAS, again, that's got a battery life of 12 hours. So we actually pitched that machine into the Australian Air Doctors Service. So, you know, it's a very robust and hard-wearing machine. The AFIAS it's a very serious machine. It's more geared towards hospitals, clinics. It does 40 tests. It does a lot of capillary tests, and it does a lot of whole blood serum and plasma tests. However, the ones we're pushing out front are the ATR 900 and the IDL 101, which I think are more suited towards pharmacy than the AFIAS. But, you know, there are certain clients who have talked to us and said, you know, we want to do phlebotomy. We actually want to go that extra mile. So, you know, there are pharmacies out there who will want that. So, on to the next page, please, Gary. Okay, this is the ATR 900. You will have this presentation. Actually, you'll probably have a more advanced presentation sent to you after this webinar, which will explain in more detail all about the Pathfinder and the machines that we're using and how we're trying to achieve our goals and our missions, and you know, the timelines and how we perceive we're going to do it, which we will. Next slide, please. I think these are the machines which I've just gone into and explained pretty well what they do. IDL 101, again, cardiac markers, diabetes indicators, inflammation, infection, fertility and reproductive hormones, thyroid function, renal and liver function, and early stage cancer markers. So, you know, all of our machines do those basic conditions, those conditions. Okay, next slide, which is the AFIAS. We've discussed that. Next slide, Gary, please. Well, this is back to Michael, who's gone offline.
It's actually back to me, I think, Richard.
Sorry, Gary. Yes. Back to you.
Yeah, and obviously, NPA Connects is looking to make that connection between the services that pharmacy are offering and their community. And so we are going to be supporting Richard and the Imperial Diagnostics team, and they're going to be supporting you with a number of different pieces of marketing material that can be available on NPA Connects that can be downloaded. Things like Facebook pages or Facebook banners, sorry, web banners if you have a website, through to posters and leaflets and flyers, and very specifically on the types of symptoms that you could be, also the remedies you're looking to find some answers to. So That's going to be available on NPA Connects, and the range that's available is going to be pretty extensive, and they're really going to get to the point. They're going to be quite hard-hitting posters that's going to be available to you. Oh, I think I've got a demonstration running behind here. So it's really valuable, good quality materials that will make sure that your location, your pharmacy, the awareness around there is front and center. Okay, so NPA Connects, we can talk back another day. This is really focused on the diagnostic tools. We have some questions coming in, and we'd be more than happy to kind of answer some more. But to start with, I've got 3 or 4 ready to go. The first question: do all pharmacies need to diagnose the tests? What's the procedure for that, and how can a pharmacy get benefits by doing the tests?
Right. If I'm right in answering the questions I perceive it to be, what is meant by diagnosing the tests? That I'm a little unclear about.
I think the question came in fairly early, so maybe the answers come from a latter part of your presentation, Richard. But the key thing is that the diagnosis of those tests are very straightforward, and the machine can kind of get you an answer in quick time. And as you also mentioned, the triage aspect of that.
None of the tests take longer than 15 minutes, unless, of course, you're doing phlebotomy, where you're using venous blood, serum, and plasma, because you have to account for the use of a centrifuge. But then you're getting into some serious blood taking, and you're making yourself a diagnostic center, rather than a sort of finger prick test hub for healthcare.
Okay, fabulous. Gary, the other thing I would add is look, this is meant to be an easy package to deploy. So we've all got personal health stories. So several years ago, I wasn't doing so well. It turned out I had a serious prostate condition. If I had bumped into a pharmacy that was doing PSA tests earlier on, my PSA test when it hit 39 and meant I ended up in hospital and pretty much under the knife thereafter, I would have picked up on it earlier. I'm convinced of it. If I'd had convenience access results, and all of Richard's tests and all the kit give numbers. They're not lateral flow tests that go, oh, here's a couple of lines. So you can know your numbers. That's really important. But remember, at the minute we're landing this is what we call a tier 1 phase 1 exercise. We're focused on a certain set of high volume tests, which we know the market will want, patients will want. And we talk about a 4 T's process. So you'll test them, you'll assess the result, is it in range, out of range, and what that implies, and you will then triage the patient. Now, once you triage the patient, you're probably going to transfer them either back to general practice NHS service, or if you're really worried about what you found versus the range, you may suggest they take emergency procedures. The last thing that we haven't worked up yet is the backside of it, which is once you're an IP for certain tests and certain conditions, you may be able to add on a private consumer paid for service where you treat the patient as well. So I was speaking to a pharmacy just a few weeks ago over near Bristol, and they want to get behind the vitamin D, and then they also want to prescribe and administer vitamin D injections. So that kind of next tier where we go from testing into treatment is something we will be working on in the NPA. But for now, it's a kind of a tier 1 test, mainly a triage scenario. And it's really simple numbers against really simple parameters. And why do it? Well, do it because you care for your patients. You want to build your patient network. And you also want to make some money and stay in business, colleagues.
Thank you, Michael. And the next question: what will the cost be for the machine?
The 101 and the ATR 900, they're both 2350. Ordinarily, they're 2850, but we've reduced the price for the NPA, especially for the Pathfinder campaign. The tests on average are about £10. There are certain tests like vitamin D, which are a little bit more expensive at around about 15. And AMH, which historically for IVF is probably the most important test and first one out of the chocks, because it determines if a lady is able to become pregnant and is in fact fertile. So after you take the AMH test, I'm pretty sure I'm right in saying that's when you can actually say, well, I'm going to give up, or I'm going to go ahead, because we all know it's a very costly and expensive path to follow, let's put it that way. But in the main, £10, and the recommended retail price, if you, and I'm sure that quite a few of you listening right now will use the laboratories like TDL and the London laboratory, the tests in the main are between £40 and £60. And the cost implication given to you from the laboratories are high. Now, our aim is for you to keep the money in the pharmacy. So you do the test, you take the money, you don't need the laboratories, unless, of course, they are phlebotomy or venous or serum and plasma-based tests, and you don't want to go that extra mile with doing those tests and hiring a phlebotomist. Okay.
Thank you. And just to add to that, there's a few questions coming in around cost, and one in particular, are the machines available on a leasing basis?
Not yet. We are trying to look at, and not so much that, but lease purchase. So it's not in position yet, and we haven't found the right partner. It's quite difficult to do this with medical equipment.
Okay, thank you. Thank you.
So Gary, just to add, the NPA did push at Imperial Diagnostics on this point. The actual feedback we had from quite a few bits of dialogue we've been having about this is the price points at that level were not deemed to be prohibitive. Look, yes, there are other companies out there that are charging £5,000 and £10,000 for bits of kit, and we appreciate once you get to that level. But by bringing it in around the £2 and a bit grand mark, and the return on investment on it being so quick on a reasonably, low level of activity, we didn't press Imperial ridiculously on that point, because we felt that the upfront costs would be very, very recoupable in one half decent year of trading.
Okay, that's lovely. And as a question for the NPA, will NPA be supporting us with the full service spec, including SOPs?
Sorry, I went on mute again. So yes, I think I was from Amish Patel, wasn't it? Hi, Amish. Good to get your question in. Yeah, that is the plan to enable that, Amish. And I think somebody else, Gary, had asked, was it Amish as well, about insurance?
Exactly, yeah.
Yeah, for sure. So Amish, as you know, at the minute, I dare say, conducting finger prick tests and doing the BP service for case finding, etc., is covered within your NPA insurance. Doing these finger prick testing and diagnostics is covered within your insurance as well. NPA insurance have advised that if you're moving into the phlebotomy side of it, there would be an insurance supplement. But again, when we were putting this offer together for members with Imperial, we wanted to give a package of support. So yes, the machines, the platform that you use, yes, the processes, the training, the practice, all of that, but we also wanted to make sure that you had the right protection around insurance. And lastly, we also wanted to make sure that you could promote the service, hence Gary, NPA Connects Precision Marketing Group being a key delivery partner in this. So we believe that the package we've pulled together is what makes this magical. Anybody can likely go on the internet and buy a machine. Okay, you've now got a machine in your hand. So what? Right? So with our offer, with the NPA Imperial PMG offer, you can crack on and sell it. You can crack on and make money. You can crack on and help patients. So that's the difference. Package, move, make money, help people quickly.
Fabulous, thank you. Is this service only for particular areas of the country?
At the moment, it's within the M25. The Pathfinder campaign is for, well, it's designed for 50 people, 50 pharmacies. However, as Michael said, you know, if people are super keen to come on board now, we're not going to stop them. That's for sure. So, you know, it is a Pathfinder. It'll probably last until October. And then we all going to plan, we'll have a national rollout and bring in maybe tranches of 150 at a time to doing certain areas. So, you know, it hasn't been advertised to any other areas of the country other than yours at the moment. So it's central London within the M25.
Excellent. This question goes back on the cost element. It's more about how much would a pharmacy charge a patient? Is there a recommended retail price, for instance?
That was an early question as well, wasn't it? Yeah.
Yeah.
Yeah, it's the average cost of a test is £10–11. You would need to be marking that up by 3, which is it's a natural course of actions for most businesses in this country. So if you're paying 11, 35 to £40 is very reasonable, because you'll find the laboratories will be charging you 60, 50, 60. The home tests, as Michael mentioned, you know, there's a huge influx of home tests. They're inexpensive, but I think the most important aspect you need to consider here is, do you want to take a test home? Do you want to prick your own finger? Do you want to put the blood into a vial of anticoagulant, put a lid on it, put it in an envelope, rely on the British Postal Service and wait 5 days for a test result? Now, the answer is probably no, because if you can go to your pharmacy and get a professional healthcare provider to do the test for you and give you a test result in 15 minutes, what would you do? I see you're nodding.
Good answer. Very good answer.
No-brainer.
Well, it's even worse than that, Gary, in that there was a research exercise done recently on dozens of home testing, and only a small proportion of those, when tested against laboratory, were deemed to be accurate. And this is about members and pharmacy position themselves as clinical support partners in people's health and well-being. So just picking up a product from a shelf, even if you sell them yourselves, folks, and some of you might be, it's a different transaction. And plus you can build repeat business in this as well. You can bring people back. You know, I was worried about my prostate. I might equally be worried about my lipids. I might be, as a 61-year-old man, be worried about my HbA1c. I'm worried about quite a few things, come to think of it.
Look, that's a very good point. I mean, there are quite a lot of pharmacies, and I see a lot of pharmacies in my everyday work who are selling these tests. And you know, it's a no-brainer, really, when you point that out. What would you rather do? Then, and I think I'm right in saying, with statistics, don't shoot me if I'm wrong, but I think it was 60 different home tests were tested by the MHRA, I think, and only 14 came up with reasonable results, which is a very frightening prospect if people are actually basing their health on home tests. And I think that's going to come to light because from the article that you're referring to, the MHRA are going to crack down on them. Yep. And they're going to close them down. Now, I don't know which ones they are. To be perfectly honest with you, I don't care which ones they are, but all I know is that we're providing a service that is infinitely better and safer and done by professional healthcare providers in a very short time. And it's a win-win situation for the pharmacy. They can upsell. I mean, vitamin D, take for instance, GPs don't do vitamin D tests. There are pharmacies in central London, I know, have talked to their local GPs with which they have an affinity and have said, look, please refer vitamin D patients. If you see the symptoms, refer them to us for finger prick testing. So, you know, there are various tests that the NHS don't do that can easily be referred to. I mean, you know, take, for example, you know, if you're going to go that route, do a troponin/D-dimer test. If the doctor says, you know, I think you need to go and get a blood test for cardiac, you know, a D-dimer troponin test will, and certainly an HSCRP test, will indicate that you've potentially got a problem, and then that needs to be taken further. And then you're referred to the hospital for further tests, you know, with proper professional people, doctors, you know, surgeons and such like.
Richard, so, we do have a number of questions coming in, and will the NHS pay the pharmacy to do this quick service?
I'll take that one, Richard. Not at the minute, but the NPA recognise that by landing this on a consumer basis, we further make the case for pharmacy being diagnostic hubs. Consequently, the NPA are already in dialogue with those that lead pathology services for the NHS, including the professional body that supports and leads pathology, the Institute of Biomedical Scientists. We believe that moving from consumer to commissioned could be a logical phase down the line. With the 10-year plan in play at the minute and so much change in the offing, reimagining the pathology networks out there and systems is actively happening. So look, watch this space. But for now, the offer we're landing is a consumer health and well-being point of care diagnostic offer so that you can help your patients build trusted healthcare relationships, and they will be happy to put money in your pocket so that you can help them. So yes, in the future, I personally believe, and on behalf of the NPA, I'm working to move that forward. But this is not an NHS offer we're landing now. This is a market-making consumer offer for now.
Mm-hmm. Fabulous. And do you have any templates for triaging the patient? And I think that's part of the education piece.
Yes, is the answer. Richard has done testing scale scopes. And look, colleagues, not to overcomplicate this, right? We're providing a point of care triage service, test and triage, right? It's like, oh my goodness, Michael, your PSA is 39. What is going on here? You need to get yourself along to the GP. Or my PSA is 3. And it's like, okay, you might want to check that again in 6 months or whatever, just to make sure if you get any symptoms. But this is really simple interventions, colleagues, right? This is not complicated stuff clinically or practically. We're not looking to replace NHS pathology here.
Mm-hmm. The venous, I hope I pronounced that correctly, sample is usually used for testing in surgeries and hospitals. How comparable is capillary test looking at accuracy?
Within 10 to 15% within range. As we said earlier on, we had a previous webinar. It was a question that was asked earlier on. Our screening triage service indicates there's a problem and that the patient needs to take further advice. It's as simple as that. It is not pathology. What we will advise with our testing is that there is a problem, you are high or you are low, you need to get further help. So, we can also tell them that they're fine. That their blood test is good and there's no cause for worry, which is always a good thing, isn't it?
When will it be in market? I think the question, the answer is it's in market right now. So
Yes.
people can sign up pretty much straight away. And I think we'll quickly get on to what do you do now to get involved? And maybe you can answer that one now, Richard. So if people are interested to find out more, we're going to be sending them some more information, pretty much as a standard thing with straight after this event. But if they wanted to get involved, start doing this straight away, what do they need to do?
Get in touch with me or Imperial Diagnostics. At the end of the presentation, there's a number. It's our office number. Give us a call, or they can email me directly, or they can email you, Gary, at NPA Connects. Email me directly, which is richardps@imperialdiagnostics.com. Richard PS, Papa Sierra, at imperialdiagnostics with an X.com. And I'll be able to talk to you and inform you in a greater detail. I've had 2 calls this week. They've taken an hour and a half each. And they've both, at the end of the call, decided that it's been a good idea to pursue this. So, we've sold 2 machines this week already.
Depeche has come back with a very good question. How about using NPA leasing?
That I can't help you with. Michael?
Well, look, honest to God, the feedback we got with the price point that we're talking here and the rapid payback that you can get within a relatively low level, I think a dear colleague has done some rough maths and put it on the chat, and that was almost exactly my figure as well. We haven't gone down that leasing thing based on the feedback we have had so far. However, given the insight and intel we've generated in the 2 webinars we've run, we in the NPA with Imperial are more than happy to go back and have a further dialogue about that. And I know, look, colleagues, I don't have my own name over a pharmacy myself at the minute, but I do truly understand how tight liquidity is and how difficult it is to keep the week to week and month to month money going through in any pharmacy in the land at the minute. I do truly appreciate that, but we haven't pushed at the leasing as it stands at this moment in time based on initial feedback. But we will take that conversation back and kick it around again with Richard and our other colleagues in NPA.
And probably the notes you were reading there, Michael, was Deepak. He kind of said at £2,350 and charging £10 per test, but it's not charging £10 per test. It's actually
30-40, yeah,
£30 to £40 per test. You'll need to do about 5 tests a week to break even just after a year. Who are your competitors? You must have done the research. I suppose the competitors and what's their price point is probably the answer that's being looked for there.
So a lot of this is about labs, Richard, isn't it, at the minute? And
yeah, it
labs
is.
we think we're being really disruptive here by bringing a new value equation to the market. But Richard, I know you've, as our boffin in Imperial, I know you've looked at this really deeply. What would you guide on that?
We've actually worked with over the last 4 years a number of different machines, and for one reason or another, one we were very sad about because it tested well, but the after sales service and the delivery was appalling, and it certainly wasn't a machine that we would work with the NPA on. It was a company based in China, and you couldn't get hold of them. It was all done on text, and the video, for one reason or another, we've worked with 5 different companies, and they haven't worked out. The one that we've had in our portfolio the longest is the IDL 101, which has been a stalwart machine, which is this one. It's not very pretty, but if you felt the weight of that, it's solid state, it's hard working, it's got a good battery life, and it does 87 tests, including venous, serum, and plasma. And it's got a good portfolio of capillary tests. So yeah, I mean, we do know the competition, but we've pretty well worked through the competition before any of the people in this country have got hold of them. And we've decided for one reason or not to work with them. And we're pretty satisfied right now that the machines that we're working with, the AFIAS, the ATR 900, and the 101, are the best machines on the market, certainly for pharmacies.
And the other, I mean, Richard's talking about the competitors in terms of provision of kit, and we stand by what Richard has said in terms of the quality of the kit. But truth be told, there isn't an at-scale market competitor yet. I'm in Northern Ireland at the minute, actually, where I come from originally. I don't live here now, but everywhere I drive in Northern Ireland, there's massive billboards at the minute advertising Randox laboratory services. Come and get yourself checked at a Randox lab. That'll be 250, that'll be 350 quid, whatever. Pal of mine just had some tests done because, like me, he's a middle-aged man, 400 quid. So you know, the labs have had their own way. Our plan is to disrupt that market, make your patients happy, your customers happy in your pharmacy, and give you a fair return on the backside of it. Take the consumer-based learning and at-scale delivery and help make the case for us to do more within the NHS. So look, that is in essence the market plan. And the Institute of Biomedical Scientists, who guide and form policy and practice for pathology in the United Kingdom, they're working with us directly in the NPA to tramline how we move this all forward. So we think we're bringing a really sensible approach, but it is a little bit Wild West out there, Richard, isn't it? With lots of different kit, lots of different people. You could Google and buy a bit of kit, but it wouldn't be one the NPA would want to recommend at the minute. We're happy working with Imperial and what we've got on the table at the minute.
We've done research in the field, so we've actually had exclusives with products that we've given up. We've actually resigned our exclusive agreements and said, look, I'm sorry, we just can't we can't sell this. You know, you Michael, for one particular product, you and Nick Kay had diabetic tests, HbA1c, with one machine that we disbanded our service with, and they both proved that you were both diabetic.
Yep, HbA1c of 7.5. And I've got a cast iron pancreas, folks. I do not have any type of diabetes. So, you know, this was in the early stages when we were playing with kit together, Richard. But we were so very impressed in the NPA that you went, yeah, no, that's not right. So, yeah.
The decision to give that up, the decision to give that machine up was partially based on the tests that we did on you and Nick Kay, who was the then chairman of the NPA. So, you know, thankfully you said, look, let's try something else. And we went back to the drawing board, and very thankfully we now have great kit, which has been tried, proven, tested. HbA1c, by the way, is not a test we do on our analyzers. It's never, not on any analyzers anywhere in the world. These tests, apart from, well, maybe the AFIAS, but we use the A1C Now, which is it's a device that comes with 10 tests, and it's a throwaway device after you've used the 10 tests. So if anybody's interested in that, then you know, we can have a proper chat if you want to get in touch with me directly.
Fabulous. We have got some questions, and I realise people they've had a very long day as well, and so just a quick question on how much time would a pharmacist have to, or a pharmacy have to, allocate each time they did a test? I think that was 15 minutes.
Maximum 15 minutes.
15 minutes, yeah.
The CRP is 3 minutes. So they range. There are different tests that take less time. None are more than 15 minutes.
Yeah. For the time constraint patients, the time, they haven't got a huge amount of time, would the GP accept the results we provide, e.g. HB1AC test or full blood test, or would patient have to do an NHS blood test? Would the GP accept the test that's being presented to them?
It would be up to the GP, but the A1C now for HbA1c it's very proven, and the manufacturer of that, he is actually diabetic, and we did tests based on 3 machines, and he took the A1C now and tested it against pathology, and it was absolutely bang on. 2% difference.
Super. Yeah, is the Pathfinder opportunity offered just for diagnostic testing, or is it coupled with onwards treatments, e.g. PGDs?
So Tier 1 Phase 1 is not for treatment, but we will be developing treatments and adding to the tiers. But the first few phases are a Tier 1 test and triage offer. We will have not yet produced the how to do onward treatment, but the NPA will be working on that as well.
Okay, and very quickly, I might be able to help here. I'm halfway towards Great Yarmouth, but can we sign up? Can we sign up in Great Yarmouth? I think if they jump up and down enough, then we'll sort that out for them. So yes, definitely Great Yarmouth.
I used to work in Gorleston, Great Yarmouth, colleagues for Boots the Chemist, so I know your fair town well.
Which warranty and aftercare do we have for the machines? It's a 2-year warranty, is that right, Richard?
2-year warranty, yes.
And it's a swap out, no quibble warranty as well, isn't it, Richard?
Well, what we'll try and do is we'll do an engineer video call, and then if that doesn't work, it's a swap out.
Right, gentlemen, I think that's been a really interesting and thought-provoking webinar today. My feedback or my wrap up on it is that there are patients out there that cannot get access to blood tests. If you think that your demographic will help or could do with this extra service, and you know that they will pay for it, and I'll give you one quick example. I had a refugee patient who was living in a hotel, paid £80 for a blood test because she was convinced she was diabetic, couldn't convince her GP, went 3 times for her appointment and asked for a HB1AC that we were discussing, and got fed up, went somewhere else and got a private blood test done just for her HB1AC. I was shocked that people, when they want the test, will pay. And even for those people that I didn't think could afford it, if a patient is desperate and they can't get their appointment, they can't get that yes from their GP, if there's something that we're providing, there is a market out there. And if you believe that your area, your local demographic, and I think that's why Central London is so key, we have such a diverse demographic of patients. You may think you'll be really surprised to see who's prepared to actually go for it. If you've got the right advertising, the right clinical credibility, and you can show that actually the best place for you to go to is one of your most trusted healthcare professionals, and that's your pharmacist, then build on that credibility. Make it something that's actually relevant to the patient. You already know your patient, so you can actually add more value to that service. I know that's how I would see it. And I think if it brings me revenue that can save, and I absolutely get it, things are not cheap. We are on the cusp every month as a contractor. We are struggling to pay the monthly drug bills. And if there's something that says to me 3 or 4 a week, I can actually think of 3 or 4 times in a week where actually a patient said, I need a blood test, and I'll say, go back to your GP. If we can even start with that number as our baseline, and we know we will get our money back, and it costs me £10 to do the test, but I know my patient's willing to pay £30 for that test, I can soon begin to see a rate of return. But it's that trusted cohort you've already got. you've got the walk-in traffic. It's about you providing the service for what they didn't realize you can offer. And it's not about getting new customers. Use the patients you've already got, use the relationships you've already got, add value to it. They will be repeat because they already are repeat returning customers, but give them a much better experience. And let's try and change the narrative of what a pharmacy can provide to its community. That's my take on what you've said today, guys.